I'm Dr. psrgupta, rheumatologist. Myself is called arthritis specialist also. I'm going to, in previous video I discussed about the rheumatology general symptoms. So now I'm going to discuss about the specific disease called rheumatoid arthritis. The rheumatoid arthritis affects 1% of the world population. It is the same so with the India also. It affects 1% population of the India. It affects more commonly in the females than males. It is in the ratio of 3:1, and it affects more commonly in the childbearing age group, that is 15 to 45 years. I don't say that it will not affect children and elderly person. It also affects the children and elderly person, but it is in the less ratio. And the people think that the arthritis is the old age problem. No, it is not at all old age problem. It affects all age groups. It never leaves any age group. It includes less than 5 years people. It includes more than 80 years old people. And the symptoms of rheumatoid arthritis is that starts with the small range joint pains. Generally it starts with the small joint pains and it progresses over to the all joints. Once it progresses to all the joints, then we cannot able to fist the hands, and it is very much difficult in the morning. You will see much difficulty once you get up from the bed. You are unable to unable to fist the hands, and you are unable to move the joints. It takes 1 hour, minimum of 1 hour to get these symptoms, and in generally it gives a relief by over the 1 hour, and while day goes on it will come down, but it will never come down. And once it is there, it is also associated with generalized body weakness, feverishness, loss of appetite, and sleeplessness, not having a good sleep. You will sleep, but it doesn't have a sound sleep. And once it is there, we'll diagnose the things and we'll go get it done the specific investigations like X-rays, CBP, ESR, rheumatoid factor. In related tests, we will go do it to diagnose the things. Once we make the diagnosis, we'll give specific drugs. Once we give specific drugs, they will get the relieved of the symptoms. Once they relieved of the symptoms, they will live a near normal life, and people will have a wrong notion that these English drugs will have a side effects. Yes, definitely it will have side effects, but that should be properly given by a rheumatologist under supervision. Once we give the drugs, we will give properly, get it done the investigations, appropriate investigations. Accordingly, we will monitor the drugs, and the doses also adjusted according to the symptoms and all those things. And the most common drugs that will be used in this rheumatoid arthritis is methotrexate, sulfasalazine, and biological agents also can be used in these diseases. Once they take the proper treatment, they will have a near normal life. Thank you.